Last time we discussed pretty well the acute viral encephalitis, and today we take off with the Toxoplasma Gondii, which is apicomplexan protozoan, kind of close relative of another apicomplexan, the malaria. It exists in a flagellated form, but generally is considered to be apicomplexan. So it's a zoonosis. It's transmitted to humans via two major sources. The main reservoir, two main reservoirs for this infection, are the rodents and domestic animals like cattle, sheep, and poultry. So at the house, in the urban settings, the transmission usually occurs when mice or rats that are infected with Toxoplasma Gondii get eaten by the cats. Interesting fact is that rodents that are infected with Toxoplasma, they stop fearing the smell of the cat's urine. So they imagine Jerry just walking out of his encampment and just walking towards the tomb like he doesn't care. Okay? So that's pretty much what happens, and that is probably one of just few examples that we know of the microbe that alters the behavior of the host to facilitate its own transmission. Okay? Now you have to appreciate that humans are essentially the dead-end host for Toxoplasma, because Toxoplasma perfectly well exists in a cycle between the cats and the rodents, or cycling through the domestic animals. Now you may ask, how does it do it through the domestic animals? Most likely it is excreted through feces and then just picked up by another animal, so it goes through the fecal-oral route. Actually, oral route of transmission is a major one. So in the urban settings, when somebody cleans the litter box of the cat that's infected with Toxoplasma, that somebody can get infected. This is the reason why pregnant women are strongly suggested to stay away from taking care of the litter box, because Toxoplasma transmission to a pregnant woman can lead to intrauterine infection with Toxoplasma. It's one of the torch pathogens, and intrauterine infection of the fetus with Toxoplasma leads to pretty severe outcomes, usually of neurological sorts. Another route of transmission is via eating the undercooked meat. We all understand that, if you go to any restaurant and you look at the menu will tell you that consumption of raw undercooked meat or poultry may lead to blah 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 blah. It's true, but we know that well done steak is not really a steak. It's like a piece of rubber. So how bad is Toxoplasma? For a healthy person, it is not. It is considered to be one of the, or maybe is a most successful parasite in the world. The estimated number of people who are infected with Toxoplasma, about 2.5 billion, which is a third of the world population. It's a lot. In immunocompetent patients, if we consider ourselves patients, Toxoplasma doesn't do anything. However, if the person becomes immunocompromised, like develops AIDS, the HIV patient develops AIDS, Toxoplasma can lead to neurological disorders, slow developing subacute encephalitis, which may take months to develop, actually. There is a treatment for Toxoplasma. Of course, I don't remember the name of the drug. Don't Don't blame me. I'm not going to ask you the name of the drug that I don't remember. There is a drug, and it was patented, and it's actually very, very interesting, and I think self-rewarding story. The drug was used to treat HIV patients, AIDS patients actually, that developed toxoplasmosis, and it was very effective in controlling toxoplasma levels. Eventually, the patent for the drug expired, and one Wall Street investment banker named Martin Shkreli, I don't know if you've heard that name, he bought that patent, and he raised the price of the drug from approximately $1 a pill to $700 a pill. There is no alternative. The patent belongs to Mr. Shkreli, and of course, it caused massive outrage in AIDS community among healthcare professionals, but they couldn't do anything because he didn't violate any laws. And his company was making a fortune, actually. They didn't invest in any development, any research, nothing. They just bought patent, started to sell, and benefited from that patent that they bought. And it caused very stern responses from healthcare officials in the US, but they couldn't do anything. Well, it turns out, in 2 months, after a thorough SEC, I think it was SEC, well, one of the commissions, one of the state agencies, started to investigate Mr. Shkreli and found multiple violations and financial fraud. And he was imprisoned, and his ownership of patent was voided, which for me says there is karma. You shouldn't do things like that. There is a hypothesis that toxoplasma may alter behavior of a human. There were some studies that suggest that levels of toxoplasma are higher in patients with schizophrenia. Is that so? Well, okay. There is a correlation. Schizophrenia patients demonstrate statistically significant higher levels of toxoplasma infection. The only question is that the interesting correlation, or is that meaningful? I seriously doubt that it has any medical importance, not because I don't trust people, but because in France, levels of toxoplasma infection reach 80-90% of population. They really like almost raw meat, so-called steak tartare. But we don't see very many schizophrenic Frenchmen running around, So levels of schizophrenia in France are not elevated compared to the rest of the world. So it depends on it really depends on a cohort that you study. So it may have been just a statistical aberrance. Another thing, if you think about it, being schizophrenic does not benefit the spread of toxoplasma by any means. I mean, it's not altered behavior, right? Does that make sense? This alteration should be evolutionary important. And in this case, it doesn't seem like one. Another subacute encephalitis, so-called SSP, subacute sclerotizing panencephalitis, tongue breaker, isn't it? It's caused by the measles infection. Sorry. You can see the lesions caused by the early stage SSP and cortical degradation and ventriculomegaly in the late stage SSP. This picture here exemplifies that although measles may sound like a temporary disease that causes just relatively short-term health problems, it may have a long-lasting sequelae. And if SSP is diagnosed early, which almost never happens, it can be treated with antivirals such as ribavirin and amantadine and interferon. However, this treatment does not really stop ever. So it means that these drugs cannot clear the virus from the brain. They can only maintain, halt its replication. The late stage SSP is uniformly fatal. You may ask how frequent it is. I can't give you the exact numbers, frequency for SSP development, but honestly, does anyone want to take any chances here? I don't think so. Okay. And it can take years, 8, 10, 12, 15 years for SSP to develop after the primary measles infection. So this summarizes the virus-caused encephalitis and other immunological reactions, which classifies here as SSP. Now, again, to remind you, what you have to know, the associated disease for an organism, like for JC, it's going to be PML, for example. For herpes, it's going to be encephalitis, not only, but encephalitis as well. You have to know the transmission. Okay, we discussed that JC, for example, is via bodily fluids, mostly saliva and urine. Virulence factors and culture diagnosis, don't worry too much about that. Prevention, whether we have a vaccine, and treatment. JC treatment by zidovudin is sort of questionable. Okay, acyclovir can be very, very effective against herpes. We've talked about prions before, but it's worth to mention them once again. So prions is the transmissible disease caused not by the viruses, but by the abnormal proteins. Everybody remembers, I believe, the mad cow disease outbreak in England in 1996, I think it was, 1993, something like that. So mad cow disease is essentially caused by prions, and a general name for those diseases are spongiform encephalopathies. You can see on that slide the spongiform lesions in the brain tissue. Essentially, when meat or worse, brain tissue or nervous tissue of a diseased animal is consumed, that potentially puts the person who eats it at risk. The incubation period for the disease is extremely long. By long, I mean 20, 25 years. So actually, if you want to try a mad cow, you might as well just wait till you're 80 and then eat it. There are chances you're not going to make it till SSP develops. Okay. The Creutzfeldt-Jakob disease, which is the most common human spongiomorph encephalopathy, Prion disease, manifests as progressive dementia. It is often mixed up with Alzheimer's, and some aspects of the brain pathology are similar. Prions form amyloid plaques, like you can find in the brain of people with Alzheimer's. Up to maybe 5-6 years ago, the diagnostic tests for prion disease, for Creutzfeldt-Jakob's, were only post-mortem. So patients didn't know what they were dying from. Recently, the test was developed that allows to very accurately test the cerebrospinal fluid of the patients for the presence of prion proteins, the abnormal prion proteins. So at least patients now know that they have incurable Creutzfeldt-Jakob disease, for which we have no drugs whatsoever. Another rather interesting disease is fatal familial insomnia, which affects specifically the sleeping centers of the midbrain, of the diencephalon, causing people quite literally to lose sleep. And do you know, sometimes you spend like sleepless nights? You know, you think like you didn't sleep. On average, when you think you didn't sleep through the night, you sleep about half of the time. That's if you don't have any like complete like this type of pathology, okay? Like if you know that you were working the whole night on the computer, you know. Otherwise, if you think if there's an insomnia, you sleep about half of the time, which is not enough, of course. People with fatal familial insomnia don't sleep at all. They are given different drugs to put them to sleep. The drugs don't really work terribly well. So in about 2 months, they die of psychological and physical wasting, pretty much. Pretty grim perspective. And this is my rendition of mechanism for the prions. So you have normal prion, normal form, which is highlighted in blue, and not abnormal form, which is highlighted in red. And they physically interact. The good one becomes the bad one. So it's essentially a chain reaction that accumulates. Okay. Now, is Prion disease, so Prion disease is zoonotic disease. Bless you. Okay. Actually, it was discovered not as zoonotic, but I don't know how to describe it. I mentioned it before. The Aboriginal population of Papua New Guinea, they were eating each other, the brains especially, and they were transmitting this disease between the tribes. Now, well, that practice has been stopped since then. Is there a zoonotic prion disease in the United States? Anyone knows? Anyone hunts? No? It's called a deer wasting disease. It occurs mostly in states of Wisconsin, Minnesota, so like northern Midwest. And it kind of comes and goes. It's not extremely widespread. But recently 2 deer with wasting disease were shot in Minnesota, because I think they still have the law that all the game that you kill during the hunting season, you have to show to a game warden. So they will determine whether the deer has or has not wasting disease. And they found that 2 did have. You should abstain from eating that deer, but if you don't know and you don't have game warden and stuff like that, try to stick to the meat. Okay, no brain. Try to avoid any nervous tissue, which is, I understand, not that easy. Rabies. A wonderful disease. It's an RNA virus. Interestingly shaped. It's bullet-shaped with a glycoprotein-containing envelope. You can see it here. That's the Electron micrograph of the rabies virus. It's a zoonosis, which, as you all know, is transmitted by the bite of an animal, whether it's a wild animal like skunk, the most common source of rabies in Ohio, or fox, or raccoon. I think raccoons are hugely underestimated here. Okay, coyote, of course, can transmit it as well, but wild animals, I think here, skunks, raccoons, foxes, anything can transmit. The domestic animals, huh? Never thought of it. For me, it was always a bullet. Never thought of it looking like a lipstick. Yeah, well, men and women. Now, the general, how can you determine if the animal is rabid? Who should I ask? When you walk in the park, did you see a raccoon or skunk? Did you? We saw a lot. Yeah. So when you try to approach to take a shot, what they do? run away. That's normal. If they come towards you, you should run away. Because wild animal never approaches a human. Never. So if a lot of infections happen when cute little fox comes closer to kids and kids want to play with that little foxy and end up being bitten and have to get rabies shots. The prodromal phase, so incubation period is very long. Can be very long. It can last up to a year. There were recorded cases with incubation period of a year, usually 7 to 21 days. And then prodromal phase happens. So in the prodromal phase, the most prominent symptoms are psychological symptoms like depression and anxiety. When I was a PhD student, I worked with rabies. And one day I was filtering rabies virus, and a little bit of it splashed into my eye. And I didn't know how much of it was there, so I washed my eyes with ethanol. Don't ever do that. It's really, really awful. And then I thought, could I get it transmitted or not? Could I get it transmitted or not? Well, obviously I couldn't, because it has to enter the neurons. So chances to get it via the eye are like dismal. Okay, anyway. And I started to observe myself, and like in 2 days, I have depression, I have anxiety, I probably have it. Well, turned out I didn't have anything, but you know how it goes. Anyway, there are two clinical courses of rabies: furious rabies and dumb rabies. Dumb rabies is boring and simple. Person develops paralysis that crawls upwards from the site of the bite. Essentially, usually bites occur on the legs, right? And it's a crawling motor paralysis, say from the knee, if you were beat around knee, all the way up, so it starts to paralyze abdominal muscles, which is the diaphragm, respiratory arrest, eventually heart stops. So it's very slowly developing disease, months, okay? The furious rabies is much more interesting. The clinical onset of clinical symptoms is pretty fast. And the clinical symptoms involve photo, phono, and hydrophobia. So patient has to be kept in absolutely dark room, well, very dark room, with no sounds, and patient experiences hydrophobia, which means the contractions of pharyngeal muscles, even when patients see water. Doesn't necessarily when patient drinks water. So really, they have to be fed via tube and so on. Both courses are 100% lethal. Do I have that statement? No, but I should. 100% lethal. Okay, unless you get post-exposure vaccination. So the closer the bite to the head, the faster you should rush to the emergency room, because this virus travels in the retrograde manner through the neurons, the motor neurons. So it goes back through the motor neurons all the way up into the brain. The rabies vaccine was actually developed by Louis Pasteur, who vaccinated, the first person who was vaccinated was a farm boy who got 9 dog bites in the face, a rabid dog. And it almost guaranteed rabies. And Pasteur said, oh, what the heck, let's try it. Vaccinated him, and the boy was saved, worked as Pasteur gardener for the rest of his life. If you get bitten, go and get vaccine. It's not 40 injections intraperitoneally, it's now 3 intramuscular injections. Which major downside is the potential to develop allergy. So it kind of renders you more sensitive to potential allergy. Doesn't mean that you will have it, but you may have it, to various things. Does that make sense? Also, immunoglobulins around the bite prevent or slow down the spread of infection. What to do if you developed clinical rabies? Well, except for shooting yourself in the head, there is a Milwaukee protocol, because really it's an awful disease. I had a book, a monograph on the rabies, and description of the symptoms, pretty grim. Now, Milwaukee protocol was devised something like 2008, 2007. That period, I won't be able to give you any better precision. End of 2000's first years. Obviously in Milwaukee, Wisconsin, the patient with clinical rabies, the young woman, was placed in an induced coma, which was not only chemically induced coma, her body was cooled down to, I think, 22 or 23 degrees Celsius. So that slowed down the virus replication and spread very significantly. She was treated for the suppression of nerve activity by ketamine and midazolam, and antivirals like ribavirin and amantadine. I think they gave her interferon as well. It took months for her. She spent months in a coma, and finally she was virus-free. She was brought back from the coma. Now you have to appreciate, it is not a walk in the park. It is not that the person comes back from the coma, stands up, and walks away. She had a massive neurological consequences. She had to learn how to walk, how to speak. Pretty much she had all across the board a motor impairment. Okay. Since then, 2 more people were treated using Milwaukee protocol, and they were successfully treated. Now, my question to you would be, how would you eliminate, well, not eliminate, but you cannot eliminate rabies in the United States, but how would you decrease the numbers of rabies transmissions in the United States, which are very small actually, but nevertheless? Vaccine, rolling out the massive vaccination campaign, giving you a hint, isn't the ideal option, because in humans, vaccine kind of provokes the allergy. What can you do instead? Yeah, pets, yes, but most cases of transmission are from raccoons, actually. Yes, you can vaccinate animals, actually. In England, since it's an island, there is no exchange between the island and the mainland of Europe. They managed to completely eradicate rabies in the wild. There are no rabies cases in England. The quarantine for incoming animals is 6 months, so you can bring technically anything in unless you go in to live there. So what is done? It's a Poxvirus based vaccine. So it's a virus which, similar to smallpox, not pathogenic, not severely pathogenic, which contains rabies proteins. And when rabies, when it is infused, something like infused, capsules are inserted into pieces of meat. They dropped from the helicopters and animals eat it and get vaccinated. There was though a case when a dog, house dog, found one of those baits, brought it to dog's owner, and dog's owner was immunosuppressed at the time, so she grabbed the bait, and she got the Poxvirus, the actual vaccine, on her skin, which was damaged because she was gardening. She had scraped her skin before that, and the vaccine virus got into her circulation and caused a mild smallpox-like disease. But I just think, what is the chance of coincidence? that the dog of that particular immunosuppressed woman with a broken skin will find the bait and bring it to her.
My dog would eat it, like, instantly. My God, this is the best day of my life.
Right.
I can't believe it.
Right. Well,
Raining meat for me.
for some reason that dog didn't, but it was an actual case. It was reported. I think it was in Europe. I think it was either France or Switzerland where they vaccinate. So it's now, what is the reason why U.S. by itself cannot eliminate rabies? Any ideas? Canada and Mexico, exactly. So unless we have a vaccination program that extends all the way down to Panama Channel, then, you know, the resistance is futile. Polio. This is a paralytic disease, as you know, that's caused by the enterovirus called Polio Virus of the family Picornaviridae. It's a positive strand RNA virus, small, non-enveloped. You can see the Electron micrograph of Polio Virus right here. The interesting feature of that virus is that both hosts and reservoirs are humans. So like measles, it is restricted to humans. Although it circulates in the environment, it is shed in feces and is acquired by the fecal oral route. So virus can stay outside in a soil or water for up to a year. It can survive outside of the host. Well, only living things can survive. Let's put it this way. It can exist outside of the host for a year. Okay? The most of virus infections with polio virus are asymptomatic. Okay? Others, because meningitis, but generally infection with polio virus causes maybe a fever. The polio infections that lead to the flaccid paralysis, okay? Flaccid, what does flaccid mean? Anyone knows? You cannot contract muscles, okay? They are constantly relaxed, okay? Flaccid. Opposing to tetanic paralysis, okay? So, spastic paralysis when muscles are contracted. Only about 1 in 100 or 1 in 200 cases actually cause the paralytic disease. Which means if you have, let's say, there are 100 cases of polio in the outbreak. It means 10 to 20,000 people were actually infected. Does that make sense? Only 1.5 to 1% of them actually develop the paralytic, the neurological consequences. Nevertheless, since it's widespread and huge number of people who were infected, polio caused, it's more of a crippling disease. People don't regularly die of polio. I don't know, when I was growing up, I saw a lot of, well, quite a few kids older than me who suffered from polio before. So it's crippling. People have to walk on crutches till the rest of their lives. You know, FDR, Franklin Delano Roosevelt, had to deal with polio consequences for the rest of his life. So that called for development of vaccine. And Jonas Salk, American doctor, MD, and virologist, he developed inactivated vaccine. A virus was inactivated by formaldehyde. It is extremely safe and effective vaccine. Does that make sense? Inactivated, so it doesn't cause any infection. Although there was a so-called Cutter incident, if you want, you can Google it. It's Cutter incident. When the company, I think it was called Cutter Pharmaceuticals or something, based in California, they couldn't completely inactivate the virus. They invited Jonas Salk to evaluate the inactivation protocols. And Salk did really a careless thing. He said, you're fine, probably it's your analysis, it's your assays that show that virus is not inactivated. So he pushed for the release of vaccine to the market. Led to the polio infection of thousands of people, most of them developing paralytic disease. They sued the government, they sued the Qatar Pharmaceuticals went bankrupt, obviously, all amount of money. But that didn't, so it undermined the credibility of the vaccine. But in fact, it wasn't the vaccine itself. It was a manufacturing process. Since then, the control of the vaccine production was strengthened 100-fold, let's put it this way. And there were no cases like that. So now when you go to a doctor and they give you a polio shot, usually it's combined with, say, DTP vaccine, you're safe. Really, you're safe. It's very safe vaccine. The only downside of the inactivated vaccine is that virus, although you're being vaccinated and you're never going to develop polio in your life, the virus can still replicate in your intestines. It's not going to cause disease, but if you acquire it, it's going to replicate and you're going to shed it. Does that make sense? So essentially, vaccination prevents symptoms, but not the circulation of the virus. Does that make sense? A little bit after Salk, the first IPV was rolled out in 1953. Actually, first patients for IPV who were vaccinated was Salk himself, his wife, and his children. He actually gave the first shot to his son in his own kitchen. Albert Sabin, another American microbiologist, stepped forward with an idea of oral attenuated vaccine, which means it's a live virus, live polio virus, but it is weak. It doesn't cause the disease. Okay? Although American government reacted simply, look, we have vaccine. Why do we need another one? The first works perfectly. So Sabin couldn't even get money from the government for the clinical trials, and he did a very brave, I would say, and kind of reckless movement. His friend was a prominent Russian virologist, Mikhail Chumakov. As far as I know, either two or all three of his sons are in the United States. One in FDA, and a couple more in like local universities, something. So actually, Sabin was a friend, Chumakov, and he approached him, and the Soviet Union didn't have the vaccine at the time. And he said, let's just use it. It's nice vaccine. They didn't even care about the clinical studies. They just rolled it out. This probably was the biggest clinical study, quote unquote, in the world. Millions of people got vaccinated, and it worked really well. There are side effects. 1 in about 1 million of vaccinated patients developed vaccine-associated poliomyelitis. But remember, Soviet Union was no US. So, 1 in 1 million, it was acceptable price. The good feature of Sabin vaccine is that it's live. So it gives a protective intestinal immunity, preventing virus from replicating in the gut. So it essentially stops the transmission of the wild polio. Sounds awesome, isn't it? Right? If I say sounds awesome, there should be a catch. The catch was that one of the strains of vaccine polio converted back into the wild type, the full-strength virus, in the human intestines. So essentially, enter the self-perpetuating vaccination cycle. You have to vaccinate to establish immunity against the virus, which frequently is produced from the vaccine virus. You see? is there any way we can solve this problem? Apparently, what we can do, we can vaccinate, we can switch completely to an inactivated polio vaccine and wait. Because virus cannot survive forever in the soil or water. So if we get all hosts, and by all I mean 100%, every child, woman, man, everybody on Earth vaccinated against polio for a long period of time, we're going to have polio gone. Okay? That was the plan to do in 2000, just 2000. Didn't happen. Then it was 2010. Then it was 2015. The next point is 2020. Bill Gates actually pushing that agenda and spends enormous amount of money on that. In my personal opinion, those money are wasted. Not that we shouldn't vaccinate, no. But putting the goal, we should completely eradicate polio in the world, maybe does not have health benefits compared to let's reduce the number of malaria cases twofold. So in this case, we talk about 250,000 deaths a year. Instead of, how many, by the way, which countries still have polio? Any guesses? I'm not implying that you know, but which countries would you think still have polio? Where? Oh, older. That's a different story. No. Oh yeah, post-polio syndrome can happen. That's a progressive disease of the CNS, but that's old, right? Active cases of polio. Which countries would you guess? Huh? Yes, Nigeria. So now it's actually on a 3-year streak of no polio cases. Certain point they banned vaccination because they thought it's the plot of Western governments to, I don't know what, do to the population. They had immediate spike in polio cases. They realized how dumb they are. The government, of course, of Nigeria, and they allowed them to return. They now vaccinate everybody. Polio is almost gone in Africa. Any others? Which country? I'm going to give you a hint. It's a country, but there is no state in that country. It's a bunch of tribes fighting each other. I'm being very politically incorrect here. No? Afghanistan. There's a country, but there's no state. Like they have central government, which doesn't govern anything, right? Doesn't control anything. So they have polio. Northern regions of Pakistan, which are adjacent to Afghanistan, kind of constant exchange. Any other? It's a big country. It's a big country in Asia. It's a communist country. If you're not getting vaccinated, you're getting shot, right? Well, just kidding, but no, it's a mandatory vaccination. There are no philosophical exemptions, not China. If not China, then what? Another big country there. India. More than 1 billion people, a lot of them live in poverty in the rural areas. They just can't reach out, okay? They still have like maybe 100 cases a year, but they go on the decline of cases, which is good. They actually have missions. People just walk through the villages giving vaccines, and they put a mark on the door. This household was vaccinated. It's pretty incredible. Okay, with that amount of people, that's kind of an effort. By the way, for this type of vaccination, oral vaccine is better because it's cheaper. And think about this: you're given 1 dose. If you miss the next year, it's not such a big issue. It gives better protection. With inactivated, you have to have timely 3 immunizations, or maybe more. Does that make sense? Oral, you give it 1, you should do 2, but even 1 gives you good protection overall. Okay? Tetanus, or lockjaw, caused by the gram-positive anaerobic Bacillus rod Clostridium tetani. Okay? It's a spore former, and it can be found in the soil. If you argue with anti-vaxxer, suggest that next time they injure themselves out in the woods, don't take tetanus shot. Or they get bitten by an animal. Tell them just don't take tetanus shot. Rabies is less frequent, tetanus is abundant. The toxin, Tetanus plasmin, blocks the relaxation of the muscles, causing essentially a spastic paralysis. You can see the baby here with the spastic paralysis and the depiction of a man. So it usually causes the flexion, constant flexion of the arms, lock jaw, okay, and bent back. Pretty much contraction of virtually all muscles in the body, okay. Toxoid, a component of DTaP vaccine, is highly effective. That's why we do so many booster shots, okay, to maintain the levels of antibodies and memory B cells. Treatment, as you can imagine, does not necessarily and does not include antibiotics, because you don't have to have a replicating bacteria. All you have to have is the toxin itself. So bacteria may release toxin and die. Antibiotics do not help in this case. So what you need is myorelaxations, okay, which is diazepam, spasmolytics, metronidazole just in case, okay, and antitoxin, immunoglobulin. But generally, get the vaccine. Botulism is another example. It's a relative. It's also Clostridium botulinum, which produces botulism toxin. Okay. Toxin blocks the release of acetylcholine. Okay, essentially preventing the signaling between the neuron and the muscle fiber, the neuromuscular junction. The major transmission route is the botulism is a foodborne infection that can be found in improperly prepared home preserves like jams, jellies, and pickles and whatnot. Okay, essentially, you know, when you there's a jar. And the lid, if lid starts to pop up, it suggests there's some anaerobic growth under the lid and you should throw it away right away. It can be botulism and it's really bad. In infants, it can be acquired by infants from the environment since it's a spore form. And wound botulism, both in infants and in the case of wound botulism, toxin enters the bloodstream, so it's more systemic, more severe infection. You can see, by the way, the microscopic image right here, okay, showing the rods, bless you, with the spores forming. The treatment is antitoxin, okay? Until antitoxin was developed, the botulism infection was pretty much ultimately fatal. Now with the proper care, people recover. African sleeping sickness. When I was young, I read a lot, you know, adventure books about African stuff, and this disease was mentioned, the African sleeping sickness. And I always thought, what an enigmatic disease. Well, it's not enigmatic and it's not really pleasant. Transmitted by the mastigoat. The flagellated protozoan called Trypanosoma brucei, named after the gentleman with the last name Bruce. It has a biological vector, the tsetse fly. It's a fairly big fly, and its it doesn't bite like a mosquito. It actually cuts out a piece of skin. So mosquito penetrates, right? This fly just kind of pulls out a piece of skin and sucks out the blood from that little wound. And it transmits Trypanosoma brucei in the wound. It's fairly slow developing infection. It spreads through the blood into various organs, including CNS, causes splenomegaly, may cause the inflammation of the lymph nodes, and eventually it reaches the brain, and it causes slowly progressing neurological symptoms. You can see the woman kind of depicted with the sleeping sickness here. Okay. The infection can be treated, of course, with the anti-parasitic drugs. But as you can imagine, since it's prevalent in Africa, the availability of those anti-parasitic drugs is not 100%. So a lot of people still come down with that sickness, and it takes months for them to die, actually. Eventually, it's uniformly lethal if untreated. So major route for prevention of that disease is the vector control, or better, use the what we call them, DEET, right? The repellent sprays that are not readily available in Africa either. It's a zoonotic disease, so it transmits it's a zoonotic disease which is transmitted from buffaloes or just cattle and so on. Interestingly enough, when European cattle was introduced in Africa to, in attempt to make, grow some new types of cows, let's put it this way, it didn't work really well because European cattle was not adapted to Trypanosoma brucei, and European cattle all died, although local breeds of cows, they survived just fine, and buffaloes as well. Essentially, cattle and buffalo, all these, what we call them, ruminants, are reservoir rather than the host. Humans become the host. Does that make sense? Okay. So what we're going